The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Can custom-tailored vitamin packages help us achieve optimum nutrition? Every 10 to 40 years, there's a worldwide flu epidemic. What's the best line of defense against getting the bug? Back pain, neck pain, headaches. Millions suffer from pain every day, but all that can change with a little electrical balance. Is your breath your worst enemy? Fighting bad breath can involve a number of products. However, a proper dental system may be all you need. An alternative heat treatment to fight cancer is now available, but how does it compare to traditional methods? All these topics next on Today's Health. This program is brought to you in part by Nutrilab, Glaxo Wellcome, QT Incorporated, OxyFresh, and BSD Medical Corporation.
In the United States, the odds of getting some form of cancer are about 1 in 3. But you can significantly improve your risk simply by eating a healthier diet. Hello, I'm Faith Daniels, and this is Today's Health. What exactly are the right amounts of vitamins, herbs, and nutritional supplements necessary for optimum nutrition? Well, the correct answer is there is no right answer. Each individual has unique nutritional needs, and what's right for one person can be very different for another.
When you open your kitchen cabinet, are you bombarded by a cascade of bottles containing vitamins, herbs, and other nutritional supplements? It's a scene that happens over and over again every day across the United States. Nutritional needs can vary enormously. Optimum nutrition for one person could be completely inadequate for another.
The reason that there's not one right amount of vitamins, minerals, herbs, other important nutrients for everyone is that no two people are alike.
When I went to a nutritionist, I discovered I was taking way too much of some things and not enough of others. I was taking up to about 20, 30, 40 supplements. It wasn't just the number of supplements I was taking that was difficult, it was actually trying to collect them in one place.
Buying 10 to 20 bottles of many different supplements produced in standardized dosages can often mean that an individual cannot precisely or conveniently control the amounts taken. That person could end up getting too much of one nutrient and not enough of another for his or her individual needs. Many people who are confused about what exactly is the right amount of each supplement to take for their personal health and well-being, and even very experienced vitamin users like fitness experts and bodybuilders are turning to programs like Custom Vite, developed by Nutrilab, that custom package daily packets of vitamins specifically created for one individual.
The steps that I take to decide what nutrients are best for a person include doing a good history. That's one of the most important things, a thorough history, physical examination, and then various tests depending upon what I find in the history and physical examination. For example, I might use hair. I do that frequently to look for heavy metals and nutrients, minerals. I might use blood, several different types of blood chemistries depending upon what I'm trying to find.
After determining a person's nutritional needs, a custom-formulated supplement can be prescribed, and a provider like Custom Vite can create daily packets for that individual. This can ensure proper dosage of each nutrient in many fewer capsules.
There are a lot of reasons why a customized formulation make more sense, both from a compliance standpoint, economically, as well as an efficiency in terms of helping a person get healthier.
If I compare the way I used to buy vitamins just over the counter or off the shelf, the Custom Vite program is just so much more complete and it gives you a lot more confidence.
Supplement programs tailored to an individual's specific characteristics could be a key factor in helping to optimize nutrition and good health.
Back in 412 BC, Hippocrates, the father of medicine, wrote about a respiratory disease that killed many and then disappeared. Historians believe that was the first documented account of an influenza epidemic. Almost 2,500 years later, and we are still fighting the flu. The viruses spread easily and infect millions every year, and far too often they kill.
They're so small you need a microscope to see them. But influenza viruses have been terrorizing humans around the world throughout history. Even today, a flu pandemic can break out worldwide and kill millions. Influenza and pneumonia, a complication of the flu, are among the top 6 causes of death in the United States. Flu can infect anybody, and it often kills the elderly, the very young, and people with little immunity. Flu also takes a heavy toll on businesses. During one recent severe flu season, U.S. sufferers missed over 70 million days of work and had 315 million days of restricted activity.
Does this thing just start really suddenly?
Quite suddenly, I had to
The influenza isn't really a simple cold. It's often mistaken, and the term is used for many different kinds of upper respiratory tract infections, such as small coughs or nasal congestion or sinus infections. But the actual influenza is a specific disease caused by the influenza virus. It's much more severe, much more prolonged, and usually makes the patients much more uncomfortable and much sicker.
I came down with this flu approximately 3 weeks ago. My first inklings were aching and a mild upset, and I felt that it was a slight cold and that I could beat that real easy. About 5 days after I first felt it, it hit me full blown. I was in bed on my back for the next 2.5 weeks. I thought I could handle it by increasing fluids and juices and taking really good care of myself and maybe even lightly working out, and which I did all of the above to no avail.
The most effective flu treatments available today are vaccines or flu shots that can be taken before a person is infected. Some antiviral medications are available when the vaccine is not appropriate. A new class of antiviral medications, such as Relenza, developed by GlaxoWellcome, are in development. They are delivered by oral inhalation directly to the respiratory tract and could soon be new alternatives.
This is a very slow process that I've discovered you cannot hurry it. And you just have to keep up with the fluids and take the antibiotics if they're prescribed to you. But this flu has been as close to devastating as a very severe illness to me.
The flu is a viral infection, and when it strikes, an all-out war erupts within our body between our immune cells and billions of flu bugs. It's important to understand what you need to do to help your body fight this battle and what you can do to prevent spreading it to others.
It's probably inevitable that sooner or later you will get a case of the flu. What's important is to recognize what it is and to take the proper steps to get well and prevent spreading it to others. When you notice flu symptoms like chills, cough, and fever, it's a good idea to call or see a doctor because the flu can develop complications like pneumonia and bronchitis.
I got the flu. It came on quickly. One day I was a little tired with a scratchy throat, and the next day I could not get out of bed. There was no option. I could not get out of bed. I was aching, running high fevers, chills, incredibly weak. Once my fevers came down, I came back to work, but I still had a cough and I was still not feeling well.
Anyone who goes to work with the flu is really not only doing them a disservice, but doing everybody else they work with a disservice. Firstly, they're not going to function well and they're not going to feel well, but even more important, they have the possibility of spreading the flu to all the other individuals. This is not good for the company, for them, or for their colleagues.
One study showed that people who have the flu could increase the risk for accidents because job performance and reaction time can be impaired by 20 to 40%. If you must work with the flu or your workplace is experiencing an epidemic, there are steps you can take to minimize the disruption. Cover your mouth when you cough, even if you are alone. Operate office machines with your left hand, so if you pick up germs, you won't spread them when you shake hands with your right hand. Wash and disinfect your hands as often as possible, and try to keep them away from your face.
There's a lot of contact in my job with people who may or may not be sick at the time. Maybe they're carrying something, I don't know, but to prevent any germ transmission, hand washing is the most important thing I can do.
Now that I've gone through this once, I realize if I feel these severe symptoms coming on me again, I will probably take to bed a lot sooner and take more precautions with my health faster than I did, thinking that it was a cold and it was going to pass and I could continue with my normal life. I think it probably has taken longer to get over it because I tried to deny that I was as sick as I was.
The flu is a very serious illness that can have deadly complications. Our best line of defense is to try to prevent it. But even if we can't prevent getting it ourselves, we can take the steps not to spread it to others who may be more vulnerable.
How do you relieve your pain? Medication, a heating pad, massage therapy? What about an ionized bracelet? In our next story, we'll show you how our body's electrical energy can be a source of pain relief. Also, what would you do to permanently eliminate bad breath? Using a simple dental system may be the only and safest solution you'll need. Stay tuned.
What's your pain threshold? Everyone has a different tolerance for pain, but no matter how much you can accept, coping with pain can drain your energy and cause fatigue. Ancient medicine studied the energy currents in the body to help relieve pain and restore energy. And now with our knowledge of electricity, these old ideas may have inspired some innovative alternatives.
What is the price we pay for pain? That's not such a hypothetical question. In the United States, millions of people suffer from lower back pain, arthritis pain, and headaches, which causes them to miss 93 million workdays per year.
Chronic pain, the impact that it would have on a person's life can be devastating. They can go from taking merely aspirin or Tylenol all the way up to morphines and codeines and a variety of stronger products, of which then causes upset stomach, depressions, and so forth.
Recent findings have shown that pain can create an electrical imbalance of positive ions within the body.
There is a balance in the cells of one's body from the inside to the outside. And when the normal balance in the body, which is called homeostasis, is thrown off, you have an imbalance of charge in one direction or the other, and then this will send out impulses to your brain or to whatever the immediate controlling system is of that part of the body in order for it to react. And sometimes, unfortunately, it reacts adversely.
An innovative alternative, the Q-ray ionized bracelet developed by Dr. Manuel Polo, is designed to energize the body by balancing ions in order to relieve pain, restore energy, and return the body to its natural electrical balance.
When you have a severe injury or a chronic injury or a chronic problem like arthritis, you have a buildup mostly of positive ions. Wherever that is, you're going to have pain. In order to remove this, Q-ray bracelet just whips it right out of the body.
I suffered from tendonitis for 1 solid year in both my elbows. It affected my scores because I lost a lot of strength in my arms, and it hurt every day. A friend introduced the Q-ray bracelet to me and said, "Try this. It will help you. It's not magnets, it's not any kind of gimmick." So I said, well, I got to try it. And I have been without my pain for 3 years now.
When it comes to coping with pain, it's important that we have options to help relieve the suffering. A natural alternative that helps restore the body's electrical balance may be the answer for many people seeking a pain-free, healthier life.
When you get close, do others back off? Bad breath is a common problem, one just about everybody faces one time or another. Chronic halitosis, though, can offend more than people who get kissing close. It can affect your impression in both social and business situations. Fortunately, there are some new ideas that can help fight bad breath at its source.
There is a lot of confusion as far as the proper home care regimen right now in dentistry, and that is because not only do you have your regular home care programs, but you have a lot of specialty products. Things like you have breath fresheners, you have tartar control, you have whiteners, and when it comes down to it, people are spending lots of time trying to figure out what the right system is.
How many oral care products do you have in your bathroom? Do you really know which ones are right for your needs and which could actually stain your teeth? Asking your dentist about which oral care program is right for your needs can often be a good idea.
I've had some dental work done. I've had cosmetic dentistry. I've had an implant. And I never, ever considered asking my dentist what to use for oral home care.
Many dentists will recommend complete dental home care programs that can be safe for the entire family and have multiple benefits. These systems, like the OxyFresh dental system, can help individuals adopt better oral hygiene habits, which usually include brushing, rinsing, tongue cleaning, and irrigating.
I like to get my patients on a complete system that'll work for them. So they have to brush their teeth with a toothpaste, rinse with an alcohol-free mouth rinse, and scrape their tongue because there's a lot of bacteria that accumulates at the back of the tongue, and that's what causes bad breath and gum disease.
When we recommend a home system, when you do things like irrigate and you brush, you clean your tongue with a tongue cleaner, and you're using a paste and a rinse and using that all in the system together, you don't have to worry about things like having problems with breath or having a problem with decay or periodontal disease. Usually, right now, with all the agents on the market, you can come up with one program that takes care of all of them.
My dentist introduced me to OxyFresh, which has a complete system. I visit my hygienist 3 or 4 times a year. She has told me, or I can even tell, that my gums are not as sensitive. They don't bleed, and my plaque deposit has decreased 100%. Now my family is using one system, and we are very confident that our breath is fresh, and we're doing the best oral hygiene we can do at home.
Health issues can be very complex, and there's no way to cover all of them in 30 minutes. So log on to our website at vstar.com to find streaming video, hyperlinks, and much more information about any health topic. Of all the challenges facing medical science, the battle against cancer is one of the most complex and most baffling. Although more people are surviving some cancers today, the disease is still claiming far too many lives, and the survival rates for many tumors are still low. New therapies are needed to help improve survival rates.
Breast cancer, prostate cancer, lung cancer. There are many different types of cancers, and according to the Centers for Disease Control, they add up to the second leading cause of death in the United States.
In most cases, cancer begins with the growth of a malignant tumor. It usually starts to form in one local area, but then can spread or metastasize into other organs and glands throughout the body. The key to surviving cancer is to either eliminate the tumor or stop the growth of that malignant tissue before it can spread.
When you're given the news that you have cancer, it's a feeling that no one can know unless you've been there. It feels like you've been kicked in the stomach.
Surgery, chemotherapy, and radiation have been the most effective weapons to date in battling cancer. But another alternative, called hyperthermia, can also help improve survivability on its own, as well as help increase the effectiveness of other treatments.
Hyper means above, thermia means temperature. So what you're doing is you're raising the normal body temperature of 37 degrees centigrade to enhance the effect of radiation primarily, but we use it a lot with chemotherapy too.
After I was diagnosed and I was sent to my surgeon. He thought that I was a prime candidate to try the pre-op treatment, which involved the chemotherapy and the radiation. And he sent me to Dr. Stroop. And Dr. Stroop is the doctor that introduced me to hyperthermia.
What I want to advocate or talk to you about today is the use of a new kind of treatment called hyperthermia.
After he explained it to me, and he showed me the machine and told me exactly what was going to happen, I decided that I needed all the help I could get, so to speak.
Hypothermia trials consistently across the board are showing a 20 to 30% improvement on the type of results we had before, and that is such a big improvement.
We know for sure that if you add hypothermia to radiation to patients with cervix cancer, that you get better results in terms of the tumor disappears and patients have a better chance to get cured.
For example, head and neck cancers, they can be very well treated with hyperthermia. Breast cancers, some pelvic cancers like prostate cancer and gynecologic cancers, these are the sites that can be treated very well with hyperthermia.
When it comes to cancer, any treatment that impairs tumor growth or helps existing therapies work more effectively gives us another reason to have hope.
The struggle against cancer requires our best and brightest innovations. Hyperthermia is another powerful treatment that gives us one more weapon against the second leading cause of death in America. This promising therapy uses focused heat, and the result may be widespread hope.
The power of hyperthermia is that it has a high potential to increase the effect of current conventional techniques such as radiotherapy or chemotherapy. And besides enhancing the effect, it has no toxicity, so it does not harm you as a patient.
Hyperthermia is a process of focusing enough heat on a tumor to either kill it or damage it severely. But how much heat is needed to do this? And how can it be localized so that it doesn't damage other parts of the body?
When you treat a cancer patient using hyperthermia, you must be able to focus the radio frequency or microwave-generated heat into a very specific region.
You take look at the body in sections like we do with CT scans or MRI scans, and you can study three-dimensionally the tumor in the normal tissue. And then you do planning, you do mock computerized setups of heating and look at heating patterns in those patients. And that gives you an ability to plan your heating, deposit and steer that heating exactly where you want it.
The treatment of cancer using hyperthermia relies on advanced equipment like the BSD 2000 developed by BSD Medical Corporation. The BSD 2000 can precisely deliver heat treatments into the malignant region without harming healthy tissues.
The treatment lasted about 6 weeks, 5 to 6 weeks, coupled with radiation and chemotherapy. And they all three ended at the same time. And then I had to wait a couple of weeks after that, and I was re-examined and to determine if the tumor had shrunk, and it had. Then I waited about a couple of months and was re-examined, and they could not find the tumor.
It is not an expensive treatment to use compared to some of the types of chemotherapy or surgery and irradiation. And most importantly, it actually produces excellent benefits to the patient.
I think for anyone battling cancer, new treatments offer a lot of hope. And I tried hyperthermia, and I think anyone else should, because it really worked. The last checkup that I had with my oncologist, he said, I hate to use the word cured with a cancer patient, but with you, I will use that word.
We understand more about the human body and fighting disease than any other generation in history. That means we know what steps are necessary to help prevent many serious diseases, but it's still up to us to take action and do what we can to maintain our good health and improve our well-being. I'm Faith Daniels. If you need more information on anything we covered on today's program, log on to our website at vstar.com and join us again next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.